In this segment or in this episode, we are sitting down with my personal doctor and dermatologist, someone who's helped me treat this problem, and I just feel the need to share, the information that she gives with all the ladies out there, because I really believe that it has encouraged me to know that it's not the end of the road or the end of the world that I've lost my hair. So Doc, thank you so much for making time to see me.
It's my pleasure.
I know that you're very busy, but I also know that this is something that you're very passionate about, as passionate as I am. And I think for me, it's also even more exciting because I'm getting to share a little bit of myself with people. So people get to meet my doctor and we get to share you, because I think your knowledge is so important. So I remember when I first came to see you, I sat down and you had a look at my hair or my scalp, and you immediately said, this looks like CCCA. And you did a biopsy, and that's pretty much when my journey with my hair loss began. So before we go any further, I want to because I know when you said CCCA and even when you said alopecia, I went completely blank. I didn't know what it was, what it meant, what does it mean? Is it life-threatening? So I think before we carry on with the conversation, are you able to, of course you're able to, but please can you just chat us through very briefly exactly what is alopecia?
Alopecia is just a name that means loss of hair. So there are different types of alopecia. So it's not a diagnosis. It's really a descriptive term to say hair is being lost.
Oh.
So it's important to know, why is the hair being lost? Is it nutritional? Is it pulling? Is it an infection? Is it a disease with lots of symptoms? It's important to have it diagnosed. Not because alopecia just means hair is being lost.
Oh.
It's not specific for any type of hair loss, which would need specific treatment for that particular type.
Right. Okay. Interesting. I've just learned that now as well, because I thought it meant it was in line with what I was diagnosed with, but it actually is quite broad.
Form of alopecia. When you say you have alopecia, then we check which form of alopecia do you have, so that we can treat you according to that diagnosis.
Okay. And another word is biopsy.
Biopsy is a skin sample that we take, where we get a sample of the skin as it is for the lab to check and see the cells, to see, because in this particular condition we look for, are the follicles reduced in number, maybe damaged with chemicals only. Then we need to know, is it a loss that's caused by follicles or caused by just the hair. So the biopsy helps us. It's a skin specimen that shows how many hair follicles are there in a particular sample, how many cells, what type of cells are there, because all those are diagnostic. Is the hair replaced with scarring, which is important, so that we can discuss with the patient the prognosis. Because if all the hair is replaced with scarring and there are no cells, we know that it's end stage. So there's no point in treating, but to refer for hair transplantation.
Sure. Very interesting. And I guess, for me, my journey when it started, obviously we did the biopsy and the result came back as CCCA. And I went public with that, which is something that was very important for me, because I felt there was a big need for it. I didn't realize how big the need was until I went public. Then suddenly I got this flood of women, asking questions and wanting to know, and I just, I think for the purpose of just explaining to everyone, what is CCCA in particular?
The term CCCA is an abbreviation that stands for central, because it's descriptive. Central, because the usual form of CCCA begins in the crown centrally, and then it's central. Centrifugal, meaning that it spreads by spreading from the center, then it spreads from the center on a broad way. Cicatricial, meaning scarring, alopecia. So it's an alopecia that begins on the central area, spreads and scars. So it's a specific descriptive term for this particular alopecia.
Sure. Okay, I'm still trying to get my tongue to pronounce it. I stick to CCCA, and it's obviously a very prominent one, especially found in particularly in black women.
The studies say about 6%, but for me it's so common because I see it every day. But apparently, if women are checked, it's about 6%. Some areas is more. It depends on grooming practices of that particular region.
Sure, very interesting. So I jotted a couple of notes down just to remind me of when I was sitting down, what I really felt were burning questions that people had when they came to me. And I think one of the things, I met a woman the other day who says, she didn't know what she had until she saw my post on social media. And this was 8 years after she had started seeing the hair loss. What are the signs that are associated with CCCA? What can you see? Because I think, okay, let's start there. What are the signs that we can pick up and say, I need to go and see or seek some help?
The usual type of CCCA is the one that begins on the crown. So if there's a hair loss that starts on the crown and then spreads. But the most important thing for CCCA, normally, it is symptomatic. You can feel itch, there's sometimes burning, there's sometimes scaling, there's sometimes redness. That's important because that's when the inflammation is at its peak. We know that there are some cases where the symptoms are not felt, where they just have that central area that is hair loss. That's why the biopsy is so important, where a piece of skin is taken out and sent for analysis. But the symptoms tend to be pain, irritation, sensitivity, that patients feel in this particular area, and the hair loss getting bigger from the center.
That is exactly what happened in my case, because I had the hair loss and then it was very red. It started itching, but then it was painful, and then it slowly started growing outwardly. And that's when and also that's the other thing I think that is quite scary is when that happened to me, I didn't know where to go. People don't associate hair loss with skin, or a dermatologist. You don't think that it's a scalp problem. And I think it became such an important message for me to want to share with people, because people don't know. They think it needs to be something hair related. And that's where I want to get into, is just the importance of our hairstylists being equipped to know, what to look out for and when to send us to see a professional. So, and then another thing I wanted to chat to you about is the treatment options. So what happens a lot of the times is people see that I've been diagnosed with alopecia, and then they see the regrowth of my hair, and immediately they go, what did you use? Say, can you send me a picture of the product that you're using? And obviously I'm not at liberty to do that, because like you say, it needs to be diagnosed. It's so different. But just for CCCA in particular, what are the treatment options? Because I know a lot of people also saying that it's quite expensive, the treatment, but there's also a lot of things that you can do, I guess, post to sort of start maintaining your hair.
Depending on the level of inflammation, we can give antibiotics. The most important is steroids. Steroids topically applied and injected, depending on the level of inflammation. That's why the symptomatology helps us a lot, and also the biopsy helps us. If there's lots of inflammation, we know that applying creams won't be enough. We then inject intralesional steroids, we give antibiotics, we give chloroquine, the antimalarials, we give even isotretinoin, what's used for acne, is used also to halt the scarring process. So depending on the severity, that's why it's important for them to be diagnosed properly, so that we know that what intervention would be good for you, because you are at that particular level.
Yes.
But antibiotics, steroids, there are some potions called calcineurin inhibitors. Those can be used also. But the main thing is to halt the inflammation, to halt the infection, and to prevent further damage.
Yes, and further damage is scarring, which means once the scar is there,
yes,
that's where you completely.
Once there's a replacement of the hair follicles, they cannot regrow. But when we treat, we're trying to regrow the follicles that are damaged but not completely destroyed. Then we stop the inflammation and allow the hair to grow and stimulate it with, we can use hair growth stimulants, but those alone, that's why people should know that treating alopecia as alopecia is not enough. You need to treat the disease that causes the alopecia.
Right.
You can't just be stimulating hair growth without treating the reason for the hair loss.
Yes. The do's and don'ts. There's obviously, I think that has been one of the hardest things for me, is sticking to the do's and don'ts, because as Black women, we love changing our hair. We love looking different. We love switching it up, from time to time. But there's obviously basic things that we can do at home or just in our day-to-day life that can help sort of prevent the inflammation? What are those things?
The biggest two is to recognize that there's CCCA in your family and being careful about not pulling your hair and not using chemicals on your hair and not over oiling it.
Oh,
Because that also aggravates inflammation. That's the biggest two. Knowing, anticipating it, and preventing it before it's a big deal. And another two is to consult immediately you suspect something is going on. To consult a dermatologist so that if the diagnosis is not clear, a biopsy should be done. That's very, very important. That's the biggest two. The don'ts are simple. Avoid any method that strains the hair follicle. You can't do anything about the genes if you've inherited it. We can only make it less impactful. Avoid anything that causes traction, any pulling, braiding tightly, rollers. Even people who have natural hair, they don't realize that the braiding every night to make it easy to comb the following day is also some form of traction. So you might avoid chemicals and then apply traction every night, trying to. So one has to be so aware of all those methods. Chemicals, of course, chemicals, dyes, even ordinary hair food. If it's too greasy, it clogs the pores and aggravates inflammation. So all those don'ts are important. The biggest don't is don't ignore having it diagnosed so that you can start doing what you know.
One thing that I've noticed is that even when I go to the salon and I do a simple hair wash, that can actually cause inflammation where, you know, the hairdresser or the person who's washing your hair scratches or pulls quite a bit. Sometimes they actually pull. Or even I've seen people, and I've done it myself, where you have a little bit of dandruff and before you wash it, you want to scratch it off a little bit just to loosen it before you wash the hair. And I've noticed with myself that it's in itself causes inflammation, because after that hair wash, I had to apply my creams and, you know, just treat the area again because it was inflamed.
I'm glad you mentioned that, because I forgot to mention the importance of avoiding that. Because the act of scrubbing is what we call Kubner phenomenon. Where you scrub an inflammatory condition, you activate it. We know for eczema, psoriasis, lichen planus, all those inflammatory conditions, if you cause trauma by combing, scratching and all that, you activate the immune response, the immunity that causes more inflammation. So that should be avoided. If it's itchy, consult your doctor. Intralesional steroids are important. They then control the problem.
So are you saying something as simple as an itchy scalp is not normal?
It has to be diagnosed. Why is it itchy? Is it a fungal infection? Is it CCCA? Have it diagnosed by a dermatologist.
So another thing I wanted to touch on, because I've noticed it on myself, is how linked is traction alopecia to CCCA. I've seen, you know, obviously I've been diagnosed with CCCA, but I've noticed that along my hairline that I'm losing my hair. And I wanted to know if there's any relation to that. And obviously also there are people who have only the traction alopecia.
It has been described that people with CCCA tend to also present with traction alopecia.
And traction alopecia is the hairline.
Is the loss of hair along the hairline because of the pulling. There is another condition though, that's why the biopsy is important, called frontal fibrosing alopecia, where you lose your hair along the hairline, but it can present with CCCA-like presentation. Sometimes we think it's CCCA, biopsy it, and find that it's FFA. So it's important to have it biopsy. If it's associated with hairline issues, we know that CCCA can, and it tends to be associated with the traction alopecia because the hair is delicate in that particular person.
Yes.
So even along the hairline there's loss and fibrosis and permanent hair loss. But there is another condition presenting with hair loss but can present with a non-specific pattern where it looks like CCCA. It's also a scarring alopecia that needs to be diagnosed with.
Yeah.
That one is also associated with pigmentation and all that, so it's easier to diagnose.
So the most important thing is any form of hair loss is not normal. Like it's not, you can't lose hair and think, oh, I'm losing hair, this is, oh yeah, I need to figure. With the moment you spot it, any form of hair loss, figure out why you're losing the hair. Because some people think it's from breastfeeding, oh, I'm breastfeeding. But the best thing to do is to figure out if that is the case. Because it could just be that it was triggered by your pregnancy, and then that's when...
There is hair loss. That's called telogen effluvium, which is caused by a stressful event like childbirth, like surgery, like anything that affects you. So there are different types. That one tends to be diffuse, like iron deficiency, thyroid problems, the nutritional kind of alopecia. That one tends to be diffuse, it's not specific for areas. That's why it's important to take a good history and not to tell your doctor what you think you have, because sometimes they then believe you and they don't think about what is wrong. I think it's safer to just say I have hair loss and let them drive the question. Don't say I have hair loss, I think I'm eating too much. I'm not eating meat, therefore I have hair loss.
Yes.
Then the doctor just gives you nutritional.
Right.
It's important to have it checked properly because there are lots of overlaps, there are lots of the need for the biopsy cannot be overemphasized. Not always is it necessary, but most of the time it is.
Something that was interesting for me to note since my diagnosis has been the unpredictability of this diagnosis or of the disease. And I think it's scary. It scares me, I know, because I don't know what the future holds. And I think there's also a lot of fear because it's like, what does the future me look like? I've obviously had to redefine my look and just be comfortable with that, but I think it's so scary, and I think that's one of the things I want to touch on, because I would imagine that for many women that is the case. There's just this fear of facing it and then going, is this going to be the rest of my life?
If it's not treated adequately, it continues. What is also predictable is that if the inflammation is halted, the further damage is stopped. And if the patient is taught that when you feel symptoms and have yourself checked regularly to notice if it's spreading, that's also predictable that if it's well looked after, it will not progress.
Right. The hair loss journey can be a very scary one. It can be humiliating, it can be embarrassing. It can be, one lady in an email described it to me as something that is murdering her dreams. And to all these emotions, I can literally relate because I've been there. In fact, I'm still there. And so I hope that this episode was as enlightening for you as it was for me when I first had my encounter with Dr. Mpofu. And I hope you know that there is always hope when you seek help in the right places. Thank you again so very much for watching this episode. Keep sending your questions, keep sending your comments. I look forward to interacting with you, and I will see you at the next live chat.